Has your doctor told you that your potassium level is low and you need a supplement? Or are you on a prescription for a potassium supplement and you wonder what a normal blood level is and what could happen to you if your level is too high or too low? By the end of this video, you will have the answers to those questions. Good morning, health minded people. I'm Dr. Snow, and I help you treat minor health issues naturally. And I work with clients and their physicians to make sure they are on the fewest medications necessary to ensure the best outcomes possible. If you are on a prescription strength potassium supplement, your doctor probably has you come in periodically for a blood test to make sure that your level is within normal range. What is the normal range and what might happen to you if you aren't normal? The normal range for potassium is usually accepted as between 3.5 to 5.1 millimoles per liter. And while some labs report it as milliequivalents per liter, it means the same thing. Anything below 3.5 millimoles per liter is considered low, and anything above 5.1 millimoles per liter is considered high. Okay, so why is potassium so important? Potassium is vital in keeping your heart, muscles, and nervous systems functioning properly. It is very important that your potassium level is within the normal range, and normally your body is great at doing that, but certain things can mess it up. We will discuss what the things are that can get your potassium level out of whack in a bit. But first, what can happen if you get too high or too low? Of course, as with anything medical, it depends on how extremely you're out of normal. First of all, low potassium is called hypokalemia. If you are slightly lower, around 3.2 to 3.4, you may not have any symptoms or have such mild symptoms that you really don't notice. Between 2.6 and 3.1, you may start having symptoms such as muscle weakness, cramping or twitching, an abnormal heart rhythm including palpitations, fatigue, or constipation. If your potassium level goes below 2.5 millimoles per liter, this is considered severe hypokalemia and can be very serious, even life-threatening. Because potassium is vital for muscles to function properly, very low potassium can cause paralysis. If the muscles of the legs or arms are paralyzed, you may not be able to walk or lift your arms properly. If the muscles in your digestive tract are paralyzed, you can't move food through properly. If the muscles of the diaphragm don't work properly, you can go into respiratory failure. In the brain, low potassium levels have been associated with confusion and mood changes. Because potassium is essential for the electrical system of your heartbeat may become erratic or stop beating, which is called sudden cardiac death. Can you see how important it is to keep your potassium from dipping into the low range? Conditions that can cause your potassium level to drop include extreme diarrhea or vomiting, eating disorders such as bulimia, chronic kidney disease, and extreme sweating. And certain medications can cause your potassium to drop, such as diuretics or water pills, high doses of insulin, overuse of laxatives or enemas, and chronic use of Sudafed. If any of these apply to you, you should ask your doctor if you need your potassium level checked. If your potassium level is low, he may prescribe a potassium supplement for you. And by the way, the potassium tablets that are available over the counter contain 99 milligrams of potassium. Since there is 75 milligrams in each milliequivalent of potassium, and prescription strength potassium contains 750 milligrams or 10 milliequivalents or more per tablet, you would have to take at least 7.5 tablets of the over-the-counter product to equal 1 tablet of the prescription strength. If your doctor prescribes potassium, fill the prescription. Did you know that a medium potato with the skin may contain 850 milligrams or 11.3 ml equivalents of potassium? But do not substitute a potato for your potassium supplement without your doctor's approval. On the other end of the potassium scale is hyperkalemia or high potassium. Anything between 5.5 and 5.9 is considered to be mildly high. Moderately high is 6.0 to 6.4, and above 6.5 millimole per liter is severely high and can be life-threatening. Symptom severity of high potassium depends on how high it is, and it may include weakness or tiredness, chest pain, tingling in the fingers and toes, nausea or vomiting, difficulty breathing, and an irregular heartbeat. And if left untreated, high potassium can cause sudden death. As you can see, many of the symptoms of low potassium are the same as high potassium, so if you experience any of these, you need a blood test to determine the exact cause. Conditions that can cause high potassium include kidney failure, dehydration, type 1 diabetes, Addison's disease, and internal bleeding. Medications that may cause high potassium include ACE inhibitors such as lisinopril, benazepril, or captopril, ARBs such as valsartan, irbesartan, and losartan, spironolactone, nonsteroidal anti-inflammatory drugs such as ibuprofen or naproxen, some chemotherapy medications, some beta blockers such as propranolol or labetalol, and potassium supplements, including those available over the counter if you take them in excess. Unless you have some underlying disease that interferes with the way your body handles potassium from food, it would be very unlikely that you would get too much potassium from your food. Unless you eat 42 or more bananas per day, you probably won't develop problems from your food. If you have found this information helpful and want more information like this, consider subscribing to my channel, and don't forget to hit that little bell so that you will be notified every Monday morning when I post a new video that's designed to help you navigate the sometimes confusing healthcare system. Foods that are high in potassium that you may want to eat more of or less of, depending on your particular needs, include avocados, sweet potatoes, spinach, navy beans, and beets. Oh, and a medium banana has about 400 milligrams of potassium. Do you ever wonder exactly what your doctor is talking about sometimes? I've created a series of videos that explain medical terms that would help clear up your confusion. Just click right here. Thank you for joining me today to learn about what a normal potassium level is and why it's so important. Stay healthy. Don't eat 42 bananas, and have a blessed week.